And what he did was he basically dropped it out
Mm-hmm. Is
because it made it messy.
I don't want to spend too much more time on Ansel Keys because everyone's talked to death about him. Is
Yes.
it established fairly well that he intentionally cherry picked this data?
Well, intent is complicated, as we have learned in the last 2 years. Um, I'm not sure. I never asked him.
Mm.
I don't know that anyone ever asked him if he intended, but there were 22 countries, and when he published it, there were only 7.
Mm-hmm.
We have the data on the other 15, and they don't fit. So I don't know. You tell me, did he or didn't he?
Got it. Okay. One more question about saturated fat that I think is important. We're talking about saturated fat, but are there multiple types of saturated fat that we should be distinguishing and thinking about, analogous to the way that we talk about omega 6s versus omega 3s?
Well, in fact, that's right. So, we've learned a calorie is not a calorie. And by the way, an amino acid is not an amino acid. And we've learned a carbohydrate is not a carbohydrate. We've even learned a fiber is not a fiber.
Mm.
And of course, a fat is not a fat. So there are two types of saturated fats, not one, two. There's red meat saturated fats, and then there's dairy saturated fats. And they are not the same either, even though dairy comes from a animal that also provides red meat. So, like, why is that? But it's true. So it turns out red meat is filled with even chain saturated fatty acids, C16 and C18, palmitate and stearate. And those, as I've said, are cardiovascularly neutral.
Got it. Red meat, saturated fats, even chained, those are cardiovascularly neutral.
Neutral,
Not good or bad.
not good or bad, neither good nor bad. Dairy saturated fat, so like in milk, turns out to be odd chain saturated fatty acids, C15 and C17. And those odd chain saturated fatty acids have a specific phospholipid signature on their tail end, which is why they stay in solution. Because after all, fat, is in milk, right? I mean, yes, the cream rises to the top, but there's still fat in milk even after the cream rises to the top. The phospholipid, allows both the oil and the water, if you will, to mix. And so um, they turn out to actually be protective against cardiovascular disease.
Protective.
Protective. Dairy saturated fat is protective
So,
against cardiovascular disease.
so are you telling us that there's no saturated fats that are clearly negative across the
That's
board?
right. That's right. There are no saturated fats that are clearly negative.
They're neutral if they're even chained, like
Neutral.
red meat, and they're actually protective if they're odd chained, like from dairy.
Exactly right. So you also have to know that, the reason everybody made a brouhaha over saturated fats was this molecule that came out of your liver called LDL.
Mm-hmm.
Now, we've already talked about VLDL. Well, LDL and VLDL are not the same either. Okay. What makes VLDL? Sugar. What makes LDL? Dietary fat, dietary saturated fat. Okay. So there's no question that dietary saturated fat increases your LDL. And there's also no question that in large population studies, LDL levels correlate with cardiovascular disease. That is also true. Okay. The hazard risk ratio for high LDL and coronary heart disease is 1.3. So if you have a high LDL, you are 30% more likely to die of a heart attack than if you don't have a high LDL. Okay, that's real. And I'm not even saying it's not. I totally subscribe to that. 1.3. Turns out the public health community has identified 1.3 as sort of what's necessary for a public health effort. So if it was 1.29, we wouldn't even be having this discussion because we'd be below the threshold. But we're at 1.3. That VLDL that I told you about before, the hazard risk ratio for high triglyceride and coronary heart disease is 1.8. So if you have a high triglyceride, you are 80% more likely to have die of a heart attack than if you have a low triglyceride. So which one is worse, the LDL or the triglyceride? Well, clearly the triglyceride. So why are we spending all this time worried about the LDL when we're not even focused on the triglyceride? And the answer is because we had a medicine for it.
So that's why when my late middle-aged mother recently went to the doctor and her LDL was high, but her triglycerides looked fine, the doctor was immediately like, you should be on a statin.
Well, that's what the guidelines say. And the guidelines suck because they're not taking into account this whole issue. In addition, there's not one LDL.
Mm-hmm.
There's two.
And we don't normally measure the VLDLs when you go to the doctor. Is that accurate?
Number one, you measure serum triglyceride when you go to the doctor. But there are two LDLs.
Mm-hmm.
So VLDL is its own thing. But there are two LDLs. There's one called large buoyant or type A, and there's another one called small dense or type B. And it's been shown that the large buoyant is the one that dietary fat raises. But the large buoyant, and by the way, large buoyant is 80% of your LDL concentration in your blood. But it turns out the large buoyant are cardiovascularly neutral.